All right, so here we are with Catherine. We're going to do her abdominal exam. She's lying down here with her knees bent. She just urinated. We're going to have a look at her abdomen here. I have examined it already from different angles. There's no pulsations noted, no peristalsis, and no scars. She also has no umbilical hernia present. And we're going to have a listen to her bowel sounds now. Excellent. Okay. So she does have bowel sounds present in all four quadrants. So now we're going to have a listen to her aortic area here, as well as her renal area and iliac and femoral arteries. So we're going to listen with the bell. Good. Good. Okay. There's no bruits present. The areas were free of bruits, no renal stenosis that I could hear. And now we're going to palpate her abdomen. So we're going to just take this off here. Good. Okay. So we palpated her abdomen. And what we're also going to do is just feel around, make sure there's no tenderness. Any tenderness in here?
Nope.
No. Okay. Great. How about over here?
Nope.
Excellent. Okay. So no tenderness, which is great. So now we're going to have a feel for her liver and then her spleen. Okay, so now we're gonna feel for Catherine's liver and spleen. So I'm gonna have you go ahead and take a deep breath in for me. Good, and you can let it out. Good, and now we're gonna feel for her spleen here. And deep breath in. Good. And out, perfect. Good, okay. So Catherine's spleen is non-palpable. And there's no tenderness when I was feeling there, was there?
Nope.
Perfect. Okay. So that's great. And now we're going to percuss her abdomen again and see how that goes. Good. Okay. So her abdomen feels tympanic. There was a little bit of dullness in her lower quadrant, which could be stool. And now we're gonna do a quick little tape test here. And we'll see how that goes. I'm gonna have you take a deep breath in. Good. And you can let it out. Good. Okay. So Catherine's liver is not enlarged. It's 8 centimeters. We've percussed from the liver to the lower rib cage area. So we got 8 centimeters, which is normal. So again, not enlarged. So that concludes our exam. Okay, so today we're going to talk about how to perform a self-breast exam. This is something that should be done monthly. The first thing that you want to note is you want to look in the mirror and look at your breasts undressed. You want to make sure that they look like they typically do. They're symmetrical, usual size and color. You want to make sure there's no swelling or pain. And then what you want to do is also note any dimpling, puckering, bulgings in skin, anything like that. And take note of the nipples. Are the nipples inverted? Have they changed any position? Any redness or swelling? Any discharge? Anything like that. So once you've inspected, the next thing to do is raise your arms. And you want to look for any changes there as well. You then want to take 2 fingers, preferably your index finger and middle finger, and feel around for any lumps or tenderness, anything like that that you may feel on your breasts that you're not typically aware of that are there. You want to note also all around the breast upwards into the armpit axilla area to make sure that there is no tenderness, swelling, lumps, pain, again, anything there. Once this has been done, typically that's about it with the breast self-exam, but you want to just make sure there's no changes in your typical norm of your breasts. And that's about it. Again, it should be done monthly. And if you notice any differences or changes, you should consult your healthcare provider. We're going to discuss a self-testicular exam that should also be done monthly, same as the self-breast exam. It's important to do it after a warm bath or shower because everything is relaxed and it's the best way to get a good feel of everything. What you want to do is you want to cup one testicle at a time with both hands. You want to look at them individually. You're going to feel for any lumps, any changes in size, irregularities, any little bumps that you may feel. It is normal for one testy to be slightly larger than the other. But if that's different, you never felt that before, then you would obviously want to maybe just get it checked out and see your healthcare provider. You want to familiarize yourself also with the spermatic cord, which is on the back side of each testicle. And you want to also look out for any redness, any swelling, anything like that typically you don't have any pain, discomfort, tenderness. Lumps can also be painless and they can also be very small. So it's good to be on the lookout for anything that isn't typically there. And again, you should discuss it with your healthcare provider if that is different than typical. So like I said, any change in size, shape, texture, swelling, redness, anything like that, you would want to report to your healthcare provider. And again, this should be done monthly. It's important for all men to do it, just like all women should be doing self-breast exams. Basically, like I said, anything different, you should report to your healthcare provider.